All right, good afternoon, everyone. Welcome to the 15th installment of the Regional Report, a GPEC Virtual Series. Very important topic today. We will be discussing healthcare and the economy. Fantastic panel coming up in just a few moments. My name is Sperling. I am the Managing Director here at the Social Television Network. If you're not familiar with STN, we are a local media company based right here in downtown Phoenix. We have a streaming network where all of our shows and segments are dedicated to local leadership, community growth, and actionable solutions. And that is where our relationship with GPEC and their president and CEO, Chris Camacho, formed. So very excited to partner with GPEC on this virtual series. I want to mention an upcoming event we have. This will be 2 weeks from now. Our future regional report will be on nerve centers, and that's regarding the latest evolution of corporations and their shared centers working with each other. That will be coming up Tuesday, July 21st. From 11 to 12. And I always want to remind everyone that you can always check out past installments of the regional report on GPEC's website. That's gpec.org/blog. Again, this is our 15th installment. So if you're joining us for the very first time, a couple of quick housekeeping items we want to go through. Today's webinar will run for approximately 1 hour. Audience members will be muted and without video. The webinar is being recorded and will be shared on the GPEC website and social media sites. You may submit questions using the Q&A feature at the bottom of your screen. And as we remind you, due to time constraints, we may not be able to get to all those questions, but know that that button is there. Should you experience any technical difficulties, you know the magic formula. Always try logging out, then checking your connection, and logging back in. And then we do invite you to share this information on social media. Please feel free to tag GPEC and use the hashtag #PHX together where appropriate. Okay, I do want to introduce our panelists and remind the audience that this regional report will be broken up into 2 sections. To start, we're going to hear a brief overview from each one of our panelists, and then we'll get into the Q&A portion of the program. Today, we are hearing from Chris Camacho, President and CEO of GPEC, Franc from Ballard Spahr, Linda Hunt, CEO, Arizona Hospitals at Dignity Health, and Tomás, León, Senior Vice President of Marketing and Strategy at Equality Health. All right, let's start with you, Chris, President, CEO, Greater Phoenix Economic Council. I know you have had a very, very busy week. You've always keeping us up to date here on the latest trends. And so if you can provide us with sort of an update here on our economy as we sit here on July 9th.
Well, thank you, Eric, and thanks to all of our GPEC partners and friends and colleagues for joining us today. We're sitting here in July. I think all of us wish we were probably in a different position than we're in, and I hope that not only individually but families are being safe as we get through this pandemic together. And I do know our community is resilient, and we will continue to address this COVID pandemic that's before us. One of the kind of clear aspects of my world and my job is to ensure that we're out communicating the brand value for companies considering investing here. And by the same token, working very closely with our healthcare and other industry leaders in partnership with our mayors and governor's office and others to ensure that we're continuing to build a competitive region. Part of the challenge that I've observed in the past just few weeks now with this recent spike within the COVID environment is we've had to put a lot of our economic acceleration plans that traditionally we would be ready to go and amplify our work in both domestic and foreign markets. But because of the serious nature of the spread of COVID and the impact to the healthcare infrastructure, which I'm sure Linda and Tomás will talk about, our focus is going to be how do we ensure Arizona gets healthy, number one, and then we can move on to economic recovery and acceleration. And so we have a lot of work before us, but again, I hope and pray that each of your families stay safe and healthy. And I know we talk, and you read in the press a lot about the debate on masks and distancing. And, you know, one thing I continue to encourage, because I was out doing a visit today with a client in the market, and 100% of the people wearing masks, we were all distanced. And that kind of practices, those kind of practices are going to allow us to move back into society, spend money in society, and get this economic train back on the track. So I'd encourage you to first and foremost to ensure those practices are maintained. Let me advance to a few visible slides, if you will, because I did want to use this time to reference what's going on in our economy. And again, we have a lot of thoughts, as you can imagine, on this being a very different kind of economic position than we've been in previous recessions, looking all the way back to the S&L crisis in the late 80s, early 90s, to the tech bust in the late 1990s, to 9/11's recovery, to obviously what you see here. The Great Recession, as you can see in the central column, referenced a very significant structural financial imbalance that evolved because of structural debt challenges, as well as liquidity being compromised, that led to what you see there, the 8.7 million jobs lost. And in Arizona, roughly 314,000 jobs were lost during that time frame. And if you recall, those of us that were here, about 51% of those jobs lost during that time were tied to construction. And so again, that market ultimately bounced back, but at the same time, we became a much more diverse economic base in the last decade than we'd ever been. So we should be very proud of that. Now, if you look on the right-hand column, you see obviously the pandemic has led us with this healthcare crisis, which is snowballing into an economic crisis. But you see the magnitude of national job losses, and the significance of the drop-off happened quicker than any other recession downturn on record. And I know the latest numbers reference about 182,000 formal jobs lost, but if you look at unemployment claims and the likelihood of what's to be projected then through the first part of July, we will likely see a roughly 250 to 275,000 jobs being lost as the formal numbers come in later this month. And that's obviously allowing us to shift higher than what we saw in unemployment back at the peak of the 2008 crisis. So again, tremendous amount of work to do, but first we have to start with addressing the healthcare pandemic and getting our numbers back on track. Go ahead. So this is also another kind of important breakdown. If you look at where jobs have been contracted since earlier part of this year, again, those 184,000 jobs that I referenced, 82% of those jobs being tied to leisure and hospitality, professional services, and other sectors. But what concerns someone like me on the economic side of this is you're seeing pronounced a number of these, the high percentage of these jobs are concentrated in these areas, and many of these individual employees that are being dislocated are in the middle skill income bracket or middle skills bracket. And so different in the last recession where you had the spread across really all incomes and all educational backgrounds, this is being very heightened and centered on middle skill workers. And so part of our work in terms of an economic acceleration plan is how not only do we continue to address the competitiveness of the region by bringing new companies and new jobs, new high wage jobs that'll be catalysts for other jobs to be created, we also believe from an equity standpoint, the getting back to work, the upskilling aspect is largely going to be a 200,000 plus individuals that are going to have to be retrained for new jobs and new skills. And so there's going to have to be a tremendous alignment with the community college network, high schools, and this is not a short-term fix. This will be a long-term kind of categorical shift in how we educate and transition a labor pool. And that's before us unlike ever before. Go ahead. So let's talk about, in my opinion, and I think rooted in fact, why we've been able to manage through such a significant, fast economic downturn in terms of jobs has been a significant active Fed. The Fed has been more active, probably arguably than ever before, in the primary and secondary corporate facility, credit facility market. And I won't pour a lot of time into this, but an active Fed has led to massive liquidity, both in large and small businesses, which has obviously led the stock market to stay relatively strong. But at the same time, you've had pretty action-oriented focuses by Congress with the PPP, which we've been talking about. I know Franc, my colleague here, is going to talk about the Main Street program as well, which we hope will meet the needs of companies that weren't able to go through PPP. So again, probably some of you are asking yourselves, well, with some of these dire consequence job numbers and industry contraction, how financially is this kind of molding the U.S. economy? Well, in the last quarter, we've propped up the U.S. economy so significantly with capital, and you'll see this on the next slide here in a moment, that a high percentage of our GDP, against our GDP, has been in the form of pushing capital into the markets. And so what someone like me watches closely is what are the actions going to be of Congress once we get to end of this month, is where you see a significant number of those middle income or middle skill workers that are dislocated from their job, filed unemployment, and are sitting on unemployment today. The doubling of those unemployment benefits go away at the end of the month. So there's going to be continued movement as the economy slowly opens up across the country for renewed job opportunity. But again, what I'm watching closely is, are we going to need a fourth iteration of a stimulus act? So more liquidity, more spending measures being placed in the U.S. economy to help sustain third quarter. There's a lot of debate as to how the third quarter is going to be rounded out after pretty graphic second quarter positions. And let's stay on this for a second because I want to touch on what this actually means. But when I look ahead at a lot of, whether it's the lending institutions like JP Morgan or Goldman Sachs, some of these other strategic consulting houses like Deloitte, the numbers for Q2 were anywhere from 30 to 38 percent contraction position in Q2. So pretty graphic downward trend in GDP. Overwhelmingly, however, Q3 is projected to be a very strong recovery, in the 20 to 25% mark. So very favorable projected Q3 positions. But I think a lot of that's been attributed to what you see on the screen here. Each country has taken a very different approach to intervening in this global pandemic. And you can see what's referenced here naturally with the United States. We've pushed a lot of spending into the marketplace, as I described, where some of the other markets were more focused on loans, loan guarantees, and equity reinforcement. So the fact that we as the U.S. have taken these measures, I do believe are going to get us on a more accelerated track. But again, I guard that optimism to some degree by the fact that we have still a significant number of our small, medium-sized businesses not only struggling, but struggling to hold on. And the intent of the PPP ultimately was to ensure that these companies could weather the storm. But unfortunately, I do think the storm's going to last a little bit longer in Arizona because of the continued spread of COVID. So let's go ahead and move forward. I'm going to finish up with kind of two final slides. And again, I promise you I'll get to some optimism here in a second, Eric. But first, looking at this picture, I've shown this slide a number of times, but I think it's important for us to be kind of grounded in where we stand. And these 9 scenarios, and there were ultimately about 27 scenarios initially about 2 months ago. And a majority of the leading consultants would have stated that A3 and A1 were the likely scenarios if we were partially effective in our intervention work of containing COVID. Now, again, there's a lot of debate. Every front page, national paper has Arizona on as the headline. And I will tell you from a GPEC standpoint, the challenge with being covered in the national press, and again, the numbers are the numbers, but the coverage alone is pushing our clients into a position where they're pausing on their visits. And we've had 13 companies in the last month put their visits on pause. So again, naturally it's a pause. It's not a cancellation, but it's a pause. So again, as we as Arizonans, I hope rise up to this challenge and ensure that we can stem this tide of growth of or increases of caseload, and obviously the impact that Linda will talk about to the hospital networks. We have to do that. Number one, that's all going to be anchored into how we recover. And the optimistic side of me tells me A3 is likely, is that we will have that precipitous fall off, we'll hit a trough, and then we will rebound in Q3. The other concerning aspect, however, is more like what you see in like a B2, where you see a contraction, a leveling off, and then spikes and fits and starts in the recovery. And that ultimately could happen if we have COVID continue to impact our healthcare network. So again, I share that with you because I do believe we are in ultimate control of this, but we have to make decisions as Arizonans to do the right thing. So let me finish here with my last minute or so to reference kind of two, I think it's final slides. We look at kind of job forecasts, and Arizona, we're so used to looking out on the horizon and seeing positive job numbers. Well, here we are in 2020 with a likely 6% contraction, which is where I do roughly think we'll be. But 2021, economists do believe that you will see recovery in job growth, and again, a lot of that's predicated on us getting this under control. So we will likely see a better position in 21. And finally, I wanted to reference our client feedback. So I've tried to do this with our business development team on a regular basis, where you see March, April, June, and we're conducting another survey process now with the 220 clients in our portfolio. And one of the challenges, as I already mentioned, the visiting time frame. So we have about a 5-step cycle for companies to make decisions. So from the time they enter our funnel on the front end to the back end when they say, Chris, we're committed to one of our cities and we're going to go vertical with a new project. That usually takes 6 to 9 months, and it takes 5 different steps. The 4th step in that process is to visit the market. So when you have a lot of these companies deciding to postpone that time frame, you're postponing ultimately jobs decisions. So again, it's important how you can see the interlinkage between healthcare and economic development from that standpoint. I do believe that prior to this more recent spike, in the early to middle part of June, kind of June, probably 7th, in that first week time frame, we started to see a lot of optimism with this conversation about clients getting back on track. With the more rampant expansion of COVID in our market, we've seen clients in terms of visitations really take a pause. And I expect that to continue until we get our numbers in check. And so again, I still remain optimistic that before we entered this recession, Greater Phoenix as a region had one of the hottest hands in the country because of our labor force, because of our quality of communities, because of our healthcare infrastructure quality. All these attributes that we have are still going to be there once we exit this global challenge. By the same token, we are seeing pretty significant trends in mass consolidation planning. And what I mean by that, companies are going through pretty ardent approach to looking at how do they reshift the way that they deploy their headcount. So the HR teams are looking at combination of remote working and central location hubs. And I do believe in the long term, Greater Phoenix is going to win dramatically in this big game. And it's going to be a long game. So I would encourage us to stay optimistic, because I do believe we're going to get through this together. And again, I just ask each of you to reiterate, being in public, wearing masks, let's get this under control so we can move to economic acceleration. So Eric, thanks for the time today, and I look forward to the panel discussion.
Absolutely, Chris. Thank you so much for all of that information, and we will bring you back for some Q&A in just a few moments. Before we move on to healthcare, let's stay with the economy for a minute, and I want to bring in Franc Del Fosse. Franc is official counsel at Ballard Spahr law firm with over 20 years of experience with a wide range of projects. He has significant experience representing public and private companies in complex security transactions, financing, and merger and acquisition deals. Franc, so again, coming off the heels of what Chris just talked about, what are you seeing from your perspective?
Yeah, so I think Chris mentioned the Paycheck Protection Program, which I think by most accounts was a highly successful program. A lot of participants in the program, and while there were some hiccups on the administration of the program, I think generally it's viewed as a very successful program. I'm going to talk today a little bit about the Main Street Lending Program, which is a program that has received maybe less publicity than the PPP. And even as of, I think today or yesterday, there were a couple articles in the Washington Post and the New York Times about how there wasn't a ton of activity in this program. Anecdotally, we're seeing a lot of banks and borrowers have interest in this program, and we're going to talk a little bit about why that is. And so if we could go to slide 1 to give some background on the program. It's kind of a nice dovetail with the PPP. As Chris mentioned, the slide 2, actually, Bethany. The PPP was supposed to be an 8-week Band-Aid to get people to maintain their payroll. And as Chris mentioned, the pause here on the economy has lasted a lot longer than 8 weeks. And even though the Flexibility Act extended that to 24 weeks, we have a lot of people still experiencing a liquidity crunch. So this lending program, which unlike the PPP does not have a forgiveness feature, is one aspect that small and medium-sized companies should look at. It was enacted as part of the CARES Act, which the CARES Act obviously came in March, and in April, the Fed Reserve released this Main Street Lending Program, which has about $600 billion worth of money to deploy. Next slide. So businesses that are eligible, unlike the PPP, a wider swath of businesses are eligible for this. If you have 15,000 or less employees and you have less than $5 billion of revenue for 2019, you're kind of pass through the initial eligibility gate. There's other eligibility requirements that obviously you need to look at, but those are the two main gating hurdles, either or. If you have less than 15,000 employees or less than 5 billion in revenue in 2019. So that creates a huge opportunity for a number of businesses, some of which qualified for the PPP and looking for something else, some of which did not qualify for the PPP. One of the limitations of the program is the loan size is pegged to adjusted EBITDA. And so businesses that, as you can look at the last bullet point on this slide, businesses that maybe in the past were relying on recurring revenue or asset-based lending, probably not a great candidate for this program. But we'll talk a little bit later about who's a good candidate for this program, but it's generally businesses that had a great 2019 and have maybe fallen on some hard times in 2020, which is a number of companies. Next slide. So similar to the PPP, the actual lending is done by a bank. So if you have interest in the program, you go to your lender. There's great resources. The Fed has set up great resources on this program. If you go to there's a borrower site for this program that has a map on it where you can look at which banks in your region are participating in the program. That number is growing. We're working with lenders across the nation, some of which haven't got into the portal yet. So we believe there's going to be a significant amount of lenders participating, similar to the PPP, that are looking to, well, a little bit different than the PPP. I think most of the PPP was designed to maintain relationships. So banks were looking to lend to their current clients. In this example, at least anecdotally, what we're seeing is that banks are looking to establish a new relationship because you can't refinance your own debt. So if you're with an existing lender and, for instance, that loan is coming due in the next 2 to 3, 4 years, you can go to a new lender. That lender is going to be incentivized to participate in this program with you because they don't have a current relationship with you. Non-banks cannot participate at this time, although there's been some discussion about whether the Fed, particularly given the early lack of participation, would expand the pool of potential lenders. The Boston office of the Fed Reserve is the one administering the program. So generally speaking, what the Fed has done is pushed all the underwriting requirements to the regional bank or the bank that's doing the lending. And so banks are using their traditional underwriting criteria to approve a loan, unlike the PPP, which obviously didn't have any underwriting standards. Once the loan is originated, 95% of the loan will go to a special purpose vehicle owned by the Fed, and the bank will retain 5%. So the bank will have an incentive to be a good administrator of the program, to help you out post-close. I think it's a great program for lenders for a number of reasons, which we probably won't cover today. Next slide. So one of the other great parts about this program is there's a wide range of potential loans. Initially, there was a minimum of 500,000. The Fed, through comments and others reasons, dropped that to 250,000. So, and it goes up to $300 million. There's 3 separate facilities. You have to look at the requirements to determine which facility is best for your situation. But that's, as you can tell, that creates a lot of different opportunities for borrowers. The basics of the program: 5-year term on the loan, which has been a challenge for some people. Some people don't like that. There is the ability to refinance. There's no prepayment penalty. So we think that a number of folks, again, that have loans coming due that normally may not have the ability to qualify based on the revenue in 2020 would look at this loan to refinance existing debt because they had a great 2019. Interest rate is great. LIBOR, as you know, is below 1% right now, so LIBOR plus 3%. It's a great loan. And another great feature is deferral on principal for 2 years and deferral on interest for 1 year. So if you're coming into a liquidity crunch and you need to refinance, this is a great program. Next slide. This is just a summary, and we are going to make these slides available to those of you who are interested in getting more granular on the program. But there's 3 basic facilities that, you know, a lot of the features are very, very similar, but as you get into the nuances, you would choose one of the 3 facilities for your purposes. As you can see, they go up in amount that you can borrow under, up to $300 million. And as you can also tell, the amount of the loan that you qualify for is tied to your 2019 EBITDA. So the first one, it has 4 times EBITDA. The next 2 are at 6 times EBITDA. Next slide. So I talked a lot about this slide, but as I mentioned, who might be a good borrower of this? Unlike the PPP, which evolved into not, the SBA had expressed concern about public companies receiving the PPP, and that evolved over the course of the loan. This loan is open to public companies, and so we believe, and anecdotally we've seen that a number of public companies are interested in this program, given the expansive eligibility requirements. And again, borrowers in industries that may have done really well last year, but the pandemic just crushed their 2020. For instance, gaming is one that we've seen a lot of interest in the gaming community, as you know, since the casinos have been shut down this year. Obviously, their prior year was a lot different. That's a great industry. Manufacturers, depending on what kind of manufacturer, we're seeing interest in that industry as well. Next slide. So pivoting to nonprofits, there has been, we think this is another area for interest. We believe that nonprofits will be looking at this. Originally under the program, nonprofits were not eligible. As many of you probably know, under SBA programs, traditionally nonprofits haven't been able to participate in most of those programs. The PPP changed that, and nonprofits were obviously able to participate in that. And the Fed quickly pivoted to allowing nonprofits to participate. The comment period for the 2 term sheets they released ended late last month, and we're in the process of waiting for them to incorporate comments that were produced related to the term sheets. And we believe in the very near future, nonprofits will also be able to participate in this program. And the slides have, as you go through the slides, we can tick through the next couple of slides. There's a summary of the 2 term sheets that are available for the nonprofits. But given the time limitations, we'll stop there and turn the time back to Eric, and happy to answer any questions that come up on the program.
Yeah, hey Frank, such great information there. I know you mentioned you'll be sharing those slides, but this is now our 15th regional report. We've had so many small to medium-sized businesses kind of wondering what comes after PPP, and I think that is a lot of great information for those businesses. So again, we do have the Q&A feature at the bottom of our screen there. Before we transition over into healthcare, I want to again remind the audience that if you do have questions for Frank, feel free to answer them there. And if we get to those before the time is up, we will try to do that. But thank you, Frank, for such great information. We will bring you back in a few moments for Q&A. But I do want to transition over to healthcare now. And Linda Hunt. Linda oversees Dignity Health's Arizona service area, which is anchored by 6 outstanding hospitals. Under Linda's leadership, Dignity Health in Arizona has grown into a respected and comprehensive healthcare system. During her previous role as president and CEO of St. Joseph's Hospital, the 593-bed facility became the busiest hospital in Arizona and attracted patients from all around the world to its Barrow Neurological Institute and the Muhammad Ali Parkinson Center. Also want to mention the Norton Thoracic Institute, now one of the top 5 transplant programs in the country. Linda, thank you so much for joining us this afternoon. We just talked about the economy, so let's talk about the impact now on the healthcare industry and the hospital infrastructure that you're seeing.
Good afternoon, Eric. Thank you so much. Okay, next slide, please. Well, this was a slide as of July 7th, and today, as everybody knows, is the 9th. We had another 4,000 plus day of positive testing. That the frightening thing about this is that we're seeing inpatient admissions in our hospitals double every 9 days. And so what we're seeing is we were prepared, as the governor asked acute care to be prepared, to go up to 150% of capacity. And we are nearing that surge capacity now. And you know, we have an open front door, and we'll talk about the back door that we need. We're also seeing rising in the numbers between 20 and 44 being admitted, not as sick, but still needing to be admitted. We're seeing approximately 50-50 split between the genders, males and females. Unfortunately, gentlemen, you're at higher risk for death if you're admitted and have COVID. The other thing is we still continue to see 65 and above being at the most risk for dying in our facilities. Next slide. Well, when this all started, and you started hearing about personal protective equipment being in shortage, we have incredible people here in the state of Arizona and at the Barrow Neurological Institute and St. Joseph's Hospital. They stepped right up because we realized we could not depend on others to create and take care of us with the equipment we needed. So the Barrow Neurological Institute has something called an innovation center. We had a physician who stepped up and created a mask to substitute for the N95 mask, which was in such short supply. And we call it the BIC mask, BIC, for Barrow Innovation Center 100. And I have to tell you, we had a lot of help in doing this. We created and have to this point over 6,000 masks. We also worked with NASA and Boeing and a variety of other people, Honeywell, to create this mask. And this mask actually has a higher ratio of removing particles out of the air for our employees than the N95s. The middle picture is isolation gowns. We have this wonderful physician, Dr. Rod Galliano, who was in the Army, who actually created a model for an isolation gown. And thanks to the National Guard and from Fabric, who was doing fashion here in the state and pivoted to creating us, working with us on creating isolation gowns. So it's been very exciting. To date, we've produced 36,000. We were able to supply the Navajo Nation with some of these gowns. And we're also looking at how do we do more of these gowns. We have created over 100 jobs at a time and looking to do more and more of those jobs. So the isolation gowns, thanks to a manufacturer who produces the fabric in Greensboro, South Carolina, we have continued to grow that business. Okay. It was not allowed, we're not allowing visitors. Sorry, for some reason my computer went to mute. So we adopted a new app where we can have families, patients, physicians communicate via either their iPhone or their iPad so that families feel that they're more connected, patients feel they're more connected. Next slide. So what can we expect, our immediate challenges? I have to say, we had workforce shortages before COVID. Now we are in dire strait. We're having to import nurses through traveling nurse programs from all over the country. We are every day still short of help with the amount of patients that we have. And the really interesting thing is our rural workforce, many of the patients that are in these rural areas have to come down from the rural areas or come up, whichever way you live, to the urban hospital. So we're being very stressed. We also have a shortage of respiratory therapists. And when you look at COVID and what happens, that has been a significant issue. Our frontline leaders and all of our staff are burned out. They're exhausted, they're tired, but they know they have to keep going because there's no one else there. Many of us have double and triple patients in normal rooms to hit the surge capacity, so that it's been very dire situations. And at times we are at 100%, and then luckily we're able to discharge some people or work on opening additional capacity. The biggest issue for us is that our front door is open and we work as an entire statewide healthcare community through the surge line on how do we get patients and get people where they need to be. Unfortunately, these people stay in our hospitals a long time, and many post-acute facilities will not take the patients because they have COVID. They're very concerned about bringing these people back or admitting any COVID positive patients into their facilities. The demand for post-acute is skyrocketing, and at this point, we still don't have a resolution. And we're hoping the governor has heard us loud and clear And he and Dr. Chris are going to help with this issue shortly. Next slide. So what are our long-term challenges? Workforce shortage is not going to go away. I think if anything, this has really pointed out to us is healthcare disparities, not only in our Native American population, but all of our people of color. We have to look at how to improve the overall quality of care and access to care for all of these people. One of my greatest concerns, and I think all of us in healthcare, is what if we have flu like we had this last year that coincides with COVID coming up? We will be overwhelmed. We won't know how to resolve that issue. So to say that we're all going to be pushing for flu shots and people to continue all of the things we're doing with COVID, even when the numbers start to decline, because the worst thing that could happen to us is we have a convergence of flu and COVID at the same time. We don't know when a vaccine is going to be available. We're hoping it's going to be soon, but that brings a whole new round of challenges. Who can access it? How are we going to afford it? We don't know. And I think the last thing for me is the financial stability of healthcare. Just like every other business, we had to shut down many of our elective surgeries in many ways that we produce revenue. And it was devastating to us. So last but not least, just last slide, please. What can we expect post-COVID? I think we're seeing an exciting thing, telehealth. We knew it was coming, but it's been advanced, and I think it will stay. I think you're going to see more acute care produced in the home so people can avoid large crowds, emergency rooms, physicians' offices. One of the options that we've looked at is remote work options for all of our staff, and we're seeing a number of people doing actually better working remotely than coming into a large office. I think creating and manufacturing our own PPE and relying less on foreign manufacturers and distributors, because we got into this crisis because we had very little manufacturing here in this country. And last but not least, we have to have more ability to not only collect tests, but to run tests. We have to have materials. We have to have drugs that right now, many of these things are only produced in certain countries in Asia. So we have to have an adequate supply of essential pharmaceuticals. Next slide, please. The one positive I want to leave you with is please remember to thank the people who are caring for all of these people every day. They're tired, they're exhausted, and a little thank you will go a long way. Thank you so much.
Absolutely, Linda, and thank you so much for your time this afternoon. We're going to bring you in just a few moments for some Q&A. We have some specific questions coming in just for you, but staying on the topic of healthcare and the impact there, I want to bring in Tomás, over 2 decades of experience in diversity and inclusion, philanthropy, and marketing communications. In his recent role as the president and CEO of the Institute for Diversity in Health Management, that is an affiliate of the American Hospital Association, he created and launched an award-winning equity of care program to eliminate healthcare disparities that engage nearly 1,500 hospitals and health systems and 50 state hospital associations in this national initiative. So again, on the heels of what Linda was just talking about, Tomás, can you get us up to speed on what you're seeing?
Absolutely. Thank you very much. And thank you, Chris and GPEC, for having me on the show today. And Chris, I appreciate your optimism. I think we need to have that in the face of this public health crisis. You know, everybody has a number of different political opinions and opinions about wearing masks, not wearing masks. And this is no time to point fingers or throw rocks. This is a time for collective action. And, you know, that's what we're moving forward on, taking collective action to collaborate at the local level with local stakeholders and with local and state government as well to coordinate and collaborate on our efforts to address this pandemic. And so we lock arms with all of you. Linda Hunt, thank you so much for your excellent presentation and the tremendous work that you and Dignity Health and your team are doing. We're all part of this healthcare ecosystem, and we have to do it together in order to slow the spread of COVID-19 and keep our families and the community safe and healthy. Next slide. To get started, I want to cover the economic and human impact on healthcare providers, the primary care independent providers, and patients, and the community at large, and highlight some of the things that we're doing alongside other partners to make that happen. Linda referenced that telehealth is here to stay. We totally agree with her on that statement. It's an unfortunate situation, but it has created an opportunity for us to create another pathway to access high quality care through telehealth. And so when this pandemic began to hit, we deployed telehealth technology to our over 4,100 independent primary care providers throughout Arizona to be able to create greater access to healthcare for their patients amidst this pandemic at a time when people were social distancing or physical distancing and not coming into the office. And so people often forget that these primary care providers, independent primary care providers, they're small businesses. These are small businesses that employ doctors and physicians, medical assistants, and serve the local community because healthcare is local. And so we're very, very concerned about the sustainability of the independent primary care providers because they make up a majority of the healthcare delivery system. And we want to make sure that we shore them up and we give them technology and support and resources to be able to sustain themselves during this time, and more importantly, create access to high quality care for their patients. And so when we activated and launched and offered technology at no cost to providers for a period of time, we provided training and toolkits and things to help them adopt and implement this technology, and provided support to educate and engage their patients to be able to learn how to use the technology. And so since then, we have around 85 active provider practices that are using telehealth since March. We've together collectively have delivered over 7,430 telehealth visits and around an average of 30 average visits per provider. So this is something that is being adopted and utilized, and it's assisting in ensuring access to quality care for people during this time. Next slide. So one of the things that we saw and did, and Linda mentioned the healthcare disparities as such a priority for Dignity Health as it is for Equality Health. We knew that when COVID hit, that communities of color were going to be disproportionately impacted because we were already seeing disparities in care and health for diverse populations, and more specifically the African American, Hispanic, and Native American. So I won't repeat the numbers already that Linda mentioned, but just point your attention to the rise in overall cases of the Hispanic Latino cases at 24%, which is now the leading population here in Arizona. And you saw nearly 36% of the hospitalized cases. So there's a disproportionate impact on the Hispanic community. And we focused on that so that we can come together with our partners and implement a community-based testing model to be able to address those issues. But we're focused on underserved, undertested, disproportionately impacted, communities that are disproportionately impacted by COVID-19. And Linda mentioned some of the other higher risk populations that are driving these cases and are most at risk of symptomology and those that are dying at a high rate. Next slide, please. Some of you may be familiar already and have heard about the testing that we've been implementing. We started with Pilgrim Rest Baptist Church to serve their members and their surrounding communities and providing testing opportunities for the African American community. And then we shifted our focus and partnered with the city of Phoenix, who outreached us to implement some testing in the Maryville area, where some of their zip codes ranked in the top 5 in the state of most exposed. And so we started looking at state and local data to be able to target and focus on the communities that were being under tested and that were higher risk to start implementing this community-based testing model, and we started collaborating with local stakeholders. And now we're partnering with all levels of government, with the Arizona Department of Health Services, who have been very helpful in providing us the financial support and mask and PPE equipment and other support to make these testing events successful, as well as the local municipalities like the city of Phoenix, city of Glendale, and we're in discussions with other municipalities to bring this testing model to their communities. Now, it's important that we're not just focused on the testing. The testing is a strategy, a part of a strategy, but you have to create education around COVID for people to understand the symptoms, to understand how to prevent and keep themselves and their family and loved ones safe. And the follow-up care, especially those that test positive, so that we understand what the next steps are. Because a lot of what we're hearing with people coming to get tested is that my employer is requiring me to get a test before I can go back to work. So they're delaying going back and providing for their families and creating economic hardship for their family until they get that test. So we have to speed up the process of getting the test and the process of getting results back. Mask distribution is important, as Chris has encouraged others to wear your mask, and then connection to essential services so people can survive the pandemic, getting access to food and rental assistance when they've lost their jobs. I mean, this is impacting families and individuals on an economic level at all levels. And then we need to tie in the contact tracing and focusing on high need, high risk zip codes as we move forward, and keep a focus on underserved, diverse populations that are being disproportionately impacted by COVID. Next slide, please. So one of the things that we're doing, we can't do this as alone, as a company, as Equality Health. We have our Equality Health Foundation has been the lead in convening and bringing together stakeholders to implement this community-based testing model in different communities. So now we're forming a coalition, a rapid community-based COVID-19 testing coalition, founded by Chicanos por la Causa and the Equality Health Foundation, partnering with all levels of government. So we create a preparedness, a readiness coalition in the region to make sure we rapidly get out testing, this testing model in communities that need us the most right now. So far, we've tested 2,300 plus individuals. We're projected to test about 12,000 over the next several months. You see the timeline of events with different municipalities that we're partnering with. And again, we can't do this alone. We're locking arms with the cities and Arizona Department of Health Services and other organizations like Chicanos por la Causa and other healthcare providers that we're working with to rapidly implement these in communities. And so we're trying to prevent the spread. We're trying to prevent the economic impact that's affecting families and small businesses. And so we need to continue to focus our attention on how we collaborate and coordinate and target our efforts most effectively right now. Next slide, please. So I just want to close there and just thank everyone and echo Linda's comments about our healthcare heroes in the front line. We couldn't do this without them. They're putting their lives on the line, especially as well as our essential workers that are out there that are still working, in grocery stores and manufacturing and transportation and other places, and they don't have the luxury of staying home to a physical distance. And so it's certainly something that we appreciate and we admire, but we need to continue to shore up support for independent primary practice providers who make up the bulk of the healthcare delivery system, because if we don't ensure support for them and sustainability, we're going to be dealing with another economic impact and healthcare crisis on our hands if we're not able to get them through this pandemic successfully. So thanks for having me. I'll take any questions as we get to that period.
Yeah, thank you, Tomás. And we are going to transition. We have a few moments for some questions now that have come in. And I'll start with you, Tomás, since you just finished your presentation. And in regards to testing, and this whole topic is on healthcare and the economy, and that scenario you painted of someone who gets a positive test and then their employer not letting them go back to work until they get another test. And so if you look at that process, it might take 7 to 14 days just to get that initial test, and then another 7 to 14 days to get that positive test or negative test on the back end. Is anything being done to improve the speed of those results?
Absolutely. There's bottlenecking and supply chain issues and process issues along the way, starting from the testing event itself. And that's something that we've created efficiency in implementing an efficient testing model. But then it's taking too long. It should take about 48 hours or so to get test results back. But because of the backlog and the huge demand in the laboratory and the reagents that are needed and the supply chain issues, that's creating a bottleneck. So there is a lot of work being done with the Arizona Department of Health Services, with Sonora and Quest partners that we are working with all through that whole process to create that efficiency so we can get the test turnaround quick enough so that it's within that 48 hours and they get what they need to provide that documentation for their employer. So it's still a challenge, but we are working together, and I am seeing more progress in that area.
And a question coming in for Linda, one of the most alarming slides we saw was the data on the recent spike, and to visually see that was alarming, and we're trying to stay optimistic here. But the question coming in, in your opinion, what is the worst case scenario for the hospital system, and how close are we to reaching that point?
Well, we have 3 zones. We have green, yellow, and red. I'd say the hospital systems are on orange now because our ICU beds are anywhere between 90 to 98% occupied, as well as our general beds. So the greatest issue for us is there are people who could be discharged to post-acute to free up other beds so that we can continue to take people. We need help there. We don't have all the answers, but we've been talking to Dr. Chris and the governor and the health department about how could we, much like California, set up a hospital that does nothing but takes patients who can't quite go home but are better and well enough that they don't need ICU type care. So that's one of the things that we're working on. I think I said to you, the worst case scenario would be we have this spike and the flu at the same time, because then every age group is vulnerable at that point.
Yeah, and then a question that just came in to that point, what criteria does a patient need to meet in order to be admitted?
Well, obviously, they have to be symptomatic. So breathing issues, high fevers, coughing, as well as if they have comorbidities, are their symptoms worse and their blood pressure's up, or they have lung disease and they need more oxygen. So there's a variety of things. Remember, there's multiple symptoms to this COVID. It's not just one or 2 things.
Right. Chris, we have a question for you coming in back on the economy. With unemployment continuing to rise, is there fear of another mortgage crisis and foreclosures that could come out of this as well?
Yeah, Eric, what I can tell you is I know a lot of state leaders are looking at their current executive orders that were put in place across the country to stem evictions. Part of the concern, there was a national report this past week that roughly 1/3 of Americans that rent or have mortgages did not pay their mortgages or rent in full. And so again, I just believe this could potentially be the first step of some very scary times in the event that, again, we're not able to open up society in a way that we're used to, or we're accustomed to spending money to help small businesses, help those employees that work for those small businesses. So we're going to be watching that very closely, because I do think that's a very important signal for the markets. And the other thing too that you have to remember as we get into, we're July and August and then into the fall, is you're going to get, and we're already getting hit. I'm sure everyone's tired of all the political ads that are already out there, but we're entering political season, and this fall there's likely to be a number of ballot initiatives on the ballot that have pretty significant implications for Arizona, from education to healthcare. To even recreational marijuana is going to be on there. So I would encourage those that are on this webcast, become a student of what's on the ballot, what the language specifically says, because there's going to be a lot of, political overtones in the messaging that are coming out. But I will tell you, again, we're a apolitical group, nonpartisan group, but yet this fall is going to have some very interesting implications for the future of our state. And so, stay close to us if you want to look at the economic picture behind each of these scenarios. But again, those are things that we're watching. That's one scenario, because if you go back and talk to a lot of the real estate folks in our community, there's a lot of optimism. I mean, we've had a really strong sales pipeline in the residential community really in the last 60 days or so. Now, a lot of that's a supply-demand equation. Probably a lot of people are leaving other areas for Arizona. But again, why I'm optimistic, I'm still guarded in that we have some big decisions coming up for our state, and I just want to make sure our parties that are close to us stay informed through that process.
And speaking of accelerating and keeping the economy on track, I have a question here that just came in for Frank. 501c6 organizations have been shut out of all SBA programs, PPP, Main Street. Is there any hope here? It says organizations like Arizona Lodging and Tourism cannot partake at all, and they have employees just like anybody else.
Yeah, so the question is a good one. It's pointing out a gap in a lot of the stimulus that's been available to date. When we say nonprofits, traditionally people are thinking about 501c3s. 501c6 is like a Chamber of Commerce type entity or a trade organization supporting certain trades. I know, having scanned the comment letters that went in during the comment period for the nonprofits, that at least one industry organization submitted a really good letter lobbying for that. So we've finished the comment period. That's been suggested to the Fed, and I guess we'll just have to wait to see if they expand it to 501c6s, which I think is a possibility.
Question coming in for Linda. Linda, is it possible to expand on the difference between a positive test and a positive case? Are those getting testing frequently, counting in the system multiple times?
The numbers that are being reported, like the 4,050 today, that is first positive tests of people who came in and were tested. And then if they're retested, I don't know where the Department of Health is categorizing that, but what we're seeing and being reported every day are people who came in symptomatic, had not been tested before, and now are testing positive.
Okay, and I just want to let the audience know we may go, and the panelists know we may go slightly over one because we do have a lot of questions coming in. Linda, is it possible for you to expand on your concern earlier about the post-acute care? Were you referring to someone who's come in, has tested positive for COVID, and then has been released and then is struggling to find care post-positive diagnosis?
No, that is not what I'm talking about.
Okay.
What I'm talking about is someone who has been admitted to the hospital because their symptoms were so severe. They are recovering, still need oxygen, still need antibiotics, still need physical care, but do not need such high-end care that they need to stay in our intensive care or in our medical surgical wings. They need people to be watching them, making sure everything is going as planned and receiving care, but not needing an actual hospital, acute hospital. So post-acute is, if you had surgery and you're not ready to go home and you need to have somebody watching you, that would be considered a post-acute.
Got it. Okay. And then would you mind expanding on the same thing Tomás talked about? Is any light at the end of the tunnel for improving testing speed, getting those results back quicker?
Oh, yeah. I think a lot of different organizations who are at this and offering this testing, as we did, you learn, you iterate, you adapt, and you create more efficiency so we can test more. One of the events we did in Maryville, we planned to test 500 and 1,100 people showed up. And we moved to an appointment-only model. We created a lot of efficiency. In the following event, we tested the same amount of people in half the time. So we're testing now 1,000 people at every event. The next event coming up July 11th with Glendale, and we're going to do more with the city of Phoenix and some other municipalities. So you really do have to create that efficiency. So we're figuring it out, and we're offering advice and guidance to others that are working on it. We're coordinating with the Arizona Department of Health Services as well to share some of that learning, and just continuing to create that efficiency, because people need it. We need to create easy access to get a test and easy access to their test results. But most importantly, people need that follow-up care consultation, especially those that test positive, because it's a very, very scary time. What do I do next? What are my next steps? How to keep myself and my family safe? And so that's why it can't just be a focus on tests. It has to be that follow-up care consultation that happens for people to guide them on those next steps.
Linda, same question, just on what are you seeing as far as improving the speed of the results?
Well, we know, I can tell you what Common Spirit Dignity is doing. We are actually setting up a core lab here that will be up and running no later than September, that will be able to do 10, 20,000 tests a day. So that it's about a 6-hour turnaround because of the new machinery that we're getting in. St. Joseph's Hospital just put in a new machine called a Panther that can do 1,000 tests a day. And the turnaround time is anywhere between 6 to 24 hours. We have tests rapid tests, but we can't get the rapid test equipment. The CFIT test can be done in 40 minutes. The problem is there's a national shortage, and really FEMA is doling them out across the country, and the company can't keep up with the demand. So we're going to have to work with the companies as well as, and I know Sonoran Quest, because Peter Fine mentioned this morning, so Sonoran Quest is working on not only getting more tests, but the throughput and tests are going to be as important to hopefully, if you had it and you had contact with me, you and I would know that I needed to be concerned and watch for the symptoms.
Perfect. Thank you, Linda. And I know, Chris, you got to hop off here in a moment. So before we close, if you guys don't mind, we're going to ask everyone to just stare straight into the camera, give us a quick smile for a screenshot here. This will be what we'll be using to share out on social media. So here we go. Okay, we've got it. And then before we close, I'll just offer up some final remarks to each of the panelists. And Frank, let's start with you on the economic side. From everything you've heard today, just give you the floor here for a couple minutes for some final remarks.
Yeah, I would just say, because my comments were generally focused on the Main Street Lending Program, very well organized program, a lot of opportunity there for both lenders and borrowers. And, you know, the PPP had a lot of challenges administratively, but we've found that as people are submitting questions, we've had a number of questions that have folded into the Q&A that's been released by the Fed. And so we're just finding the Fed's done a really good job with the program. And we hope that people take a look at it, because there's a lot of folks that might be able to participate.
Frank, thank you. And Tomás, same thing. Everything you've heard today, great discussion, you know, focusing on the healthcare side of things as well as the economic impact. Just your final remarks for us.
Yeah, I think we just, as Chris mentioned, we need to remain optimistic and lock arms together. This requires us to work together to coordinate, collaborate at all levels of the government and local stakeholders, and we can get through this together. But we need to act with urgency at this time.
And Linda, I know so much we've talked about showing appreciation for our frontline healthcare workers. Any other final thoughts here before we go?
Wear your mask. Please wash your hands, stay socially distant, don't lock arms, play like you did. And then no more than 10 people in any one place together. So you've got to help us. Social responsibility is the only way we're going to start bending this curve.
Well, Linda and everyone today, thank you so much for all of that information. What a great panel. Again, this will be available on the GPEC website. The recording will be available and the slides should be available as well. Want to mention that we do have an upcoming regional report 2 weeks from now that will be on nerve centers. Again, how corporations are working together through this. That will be Tuesday, July 21st from 11 to 12 p.m. And as I mentioned, you can always check out past installments of the regional report by visiting gpec.org/blog. Panelists, once again, thank you so much for joining us today, and to all the viewers as well. Thank you, and we'll see you in a couple weeks.